Before we get started with our presentation, I want to paint this picture for you. It's a Friday night, you're done with all your Zoom meetings, and all you will want more is to just relax. So you grab your favorite snacks, maybe a blanket or two, and you head over to the couch to spend the rest of your night binge watching that new season of Netflix. This may seem like a regular time to spend a Friday night, or maybe an entire weekend if you're lucky, but in Nigeria, many people do not share the same luxury. Because by the time you're done rewatching the last season of Game of Thrones, over a dozen families are mourning the loss of their children. Why, you ask? That's because for every single hour that goes by, 18 children lose their life to an acute respiratory infection. Although this is a very sad but true statistic in Nigeria, it does not mean that we can combat it. I hope that by the end of our presentation that you leave here with the same ambition and drive that we share to spread awareness about acute respiratory infections. Now it is time to introduce the team that's behind it all.
My name is Abrami Krishnan, and I'm a rising senior from Virginia.
My name is Rasheen Maksud, and I'm a rising junior from Maryland.
My name is Margaret Harris, and I'm a rising senior from Chicago.
My name is Jalen Jenkins, and I'm a rising junior from Maryland.
My name is Sanjana Valu, and I'm a rising sophomore from Ohio.
My name is Taylor Bolden, and I'm a rising senior from Maryland.
Our team has created a public health campaign to display a guide for the people in Bauchi State, Nigeria, to understand the importance of acute respiratory infections, and also to offer solutions to prevent this disease. As you can see here on our slide, we have put a few of our team's objectives, which is first, inform the people of Bauchi State about ARIs, create solutions for ARIs, inform people about prevention methods for ARIs, and overall just create a successful public health campaign that will be effective in the community of Bauchi State.
So what exactly is an ARI? An ARI, or an acute respiratory infection, can cause inflammation of the respiratory tract anywhere from the nose to the alveoli. There are two main types of ARIs, upper and lower, and they can each be caused either by a bacteria or a virus. Some examples of ARIs include pneumonia, bronchitis, epiglottitis, and the common cold. Although ARIs are easily preventable, they are the leading cause of death among children younger than 5 years of age in Nigeria.
ARIs are incredibly dangerous infections that kill an estimated number of 140,000 children per year in Nigeria alone. This is hard to believe because they are so easily preventable. Simply wearing a mask when sick, washing your hands regularly, and covering your cough can slow down the spread. However, these prophylactic measures are not being implemented, and as a result, Nigeria is being disproportionately impacted. Luckily for us, acute respiratory infections have symptoms that are easily identifiable. There's no long waiting period spent trying to figure out what disease the patient has contracted. This is a huge strength because it makes it easy for people to quickly get treated and take measures to prevent themselves from spreading it to other people. Unfortunately, ARIs mostly affect children between the ages of 3 months and 5 years. Some kids don't know how to practice effective hygiene and have minimal interest in their health. This turns what could be an easy preventative measure into a weakness due to the nature of children. Additionally, these children are often crammed together in enclosed classrooms where ARIs can spread like wildfire. Right now, the COVID-19 pandemic is currently underway, and it is making people much more conscious of their health. This provides the perfect opportunity to educate the community about other diseases like ARIs. Even though acute respiratory infections are easily preventable, the Nigerian climate proposes a huge threat to the people's health. Studies have shown a correlation between the rainy season and an increase in acute respiratory infections in tropical climates. Not only does Nigeria have a tropical climate, but its prolonged rainy season and short dry season make it incredibly susceptible to acute respiratory infection breakouts.
Here we have created two main solutions to tackle ARIs. First, our team has designed a community event where we encourage the people of Bauchi State, Nigeria to come together and learn about acute respiratory infections. For this event, we have created many fun activities to target children, since children are the ones that are most at risk, but also to inform the parents about ARIs and prevention methods. We have decided first to order masks for kids and supply them with markers in order for them to personally create a mask for themselves. Our team feels that this is going to be an incentive for them to wear masks more often and stay safe. We have also decided to include informational coloring pages for children to have fun and color, but all while learning how to prevent ARIs. Here, you can see our second solution is more focused on informational flyers that our entire team took part in making. We have created many different options of infographics and flyers, which I have listed here on the slide. Our goal for these flyers are to inform people about ARIs and how to identify them and how to prevent them. We've also planned out to put these flyers in many popular places in Bauchi State, Nigeria. And as you can see, we do have a lot of different flyers. And the reason for this is because we want to target every person in Nigeria, whether that's kids, adults, or maybe people who have different levels of reading. Overall, these are our solutions that our team has come together and created to help prevent and inform Bauchi State, Nigeria of acute respiratory infections.
The first flyer you see right now is our Talk That Talk ARI awareness event. We created this flyer to act as an invitation to invite the members of Bauchi State to come and join our event. Here we have a very simple layout, and we also have a quick summary so people can understand what type of event this will be about.
On this slide, you can see this is our event poster that we have created. We wanted to make this really simple, but we also wanted to make it large to show people what our event is all about.
On this slide, you can see the infographic. Our infographic will be distributed during our community event. This infographic highlights basic information about ARIs, the symptoms between upper respiratory infections and lower respiratory infections, treatment options, and prevention methods.
This is our mask etiquette flyer. This flyer is to help people wear masks properly by explaining everything you should not do while wearing a mask.
Our team has created this coloring page to give to the children that attend our community event. There are several graphics that show different prevention methods that can be taken to stop the spread of ARIs. And our team feels that by having the children color these pages, they can learn to recognize and associate these prevention methods in their surroundings.
On this slide is our general information flyer. On the left, we have a kid-friendly version that shows mostly graphics and very small information for children to understand the different prevention methods of ARIs. On the right, you can see an adult-friendly version. The adult-friendly version contains information about ARIs, as well as going into detail about the prevention methods.
On this slide, this is our flyer for Wash Your Hands 101. We thought this is important to create because it is the best prevention for ARIs. And we have simply just put what to use and advice to effectively wash your hands.
This is our prevention methods flyer, and it simply has easy ways to prevent ARIs and prevent the spread of them as well. These will be hung in common places where everyone can see them, and we've included both text and pictures to ensure that everyone in Bauchi State, no matter their reading levels, will be able to understand and implement these in their daily lives.
Our solution is low cost, informative for all age groups, and effective in stopping transmission. Around 40% of Nigeria's population is below the poverty line, and so our group's main focus is that we are giving people important information and prevention methods to stop the transmission while also being cost effective. The materials that are necessary for our solution, including flyers, posters, masks, and markers, are very inexpensive and do not require extra costs for the citizens of Bauchi. Secondly, we have created target posters for children and adults. By putting the flyers and posters in schools, children can bring their flyers and posters home to their parents and start a conversation so that they can learn about the preventive methods. And lastly, masks are proven to be effective in stopping respiratory droplets that can spread infections. By educating the public about the effectiveness of masks, we are going to help stop the spread of infections. Now, to be completely honest and transparent, we have laid out our disadvantages. Firstly, our solution requires behavioral changes. As seen in the most recent pandemic, we have seen that there are groups of people who do not believe in the effectiveness of the mask and will not wear them. So by properly educating the citizens about you, we hope that we will convince the non-believers of the mask effectiveness. Additionally, there are temporary aspects of our solution. Flyers and posters can easily be taken down, and in a couple months they may lose their effectiveness and influence.
Now it is time to discuss our plan. We will be printing out over 3,000 flyers and infographics. 29% will be placed in schools, which will be our Washing Your Hands 101 and our child-friendly infographic. Next, 43% will be placed in marketplaces. That 43% will include our mass etiquette, our formal infographic, as well as our invite for our event. Last but not least, 28% will be placed in places of worship, and that will be our second preventive measures flyer, as well as general information. During our community event, since we are targeting children within the ages of 5 and below, we know it's going to be pretty hard for them to understand and retain the information that we give them. That way, we decide to use hands-on effective learning for them. So they'll be provided with cloth masks and materials so they can decorate their own masks and take them home with them and reuse them. Then we'll be providing a coloring sheet so they can familiarize themselves with the graphics of preventing the ARI. While that's happening in the background, we will have parents in a discussion with Nigerian ally staff so they can educate themselves on what an ARI is, the best ways to prevent it, and how to raise awareness towards it. And last but not least, we have a timeline of how we want to complete this. So our first step will be contacting ally staff to figure out a proper location and time for our community event. Second thing will be printing out invitations and ordering materials. Then we'll be spreading the word through our flyers and word of mouth. And then last but not least, we'll be hosting our event.
In order to implement our public health campaign, we are requesting a total of $250. As you can see on the graph, a majority of our funds, about $150, will go towards our community event. We will be ordering over 200 masks and over 200 markers and printing over 600 coloring pages for the children. This not only engages kids with a variety of activities to enjoy themselves, but also informs them about a disease that lurks around every corner. Further, we will be printing over 600 infographics and mask etiquette flyers that will be passed out during the event. And we will also be printing over 600 invitations that will be distributed in common areas. About 40% or $100 of our funding will go towards printing over 1,800 educational flyers that will be used to inform the public about this pressing issue. As informative as flyers may be to provide information, an important aspect of education is that it should be direct and in person. This is why we are focusing a majority of our funds onto the event. Through this event, we will be able to discuss any difficulties in understanding of this disease, as well as addressing any concerns community leaders may have. This will ensure that the Bauchi State community has a full understanding of ARIs and their impact, and most importantly, the impact ARIs have on the young children. Before we end, we'd like to thank Marshall Bailey, Morgan Beal, and Dr. Aisha for encouraging us these last 2 weeks. Further, we'd like to thank our guest speakers who have helped us delve into various parts of the medical field, such as neurology and more. And last but not least, we'd like to thank our fantastic team lead, Ella, who's been encouraging us these last 2 weeks and always making us smile. Now we'd be happy to answer any questions the panelists may have.
Wonderful job, everybody. I'll be bringing in our judges, and if you could just stop sharing your screen, that would be perfect. Panelist. Okay, promoting the panelist. Okay. And Dr. Isha, we'd love to hear your thoughts first.
Thank you, all of you, for the wonderful presentation. I always like to see a nice teamwork and a productive one. You had quite a short time to prepare, but it turned out amazing. All right. Margaret, you had a very nice opening. You engaged us with the opening, and your body language and communication skills were excellent. Rushin as well, you had very good body language, and you showed clear interest in the material. Unlike Abirami, you were just reading from the script and you didn't really show much interest. And Taylor, I don't know what happened to your motivation. You were talking about the advantages as well as some of your plans, but you had poor eye contact. So you you weren't too interested, like you don't care about what you're talking about. Okay, but in general, I know what your intentions are, and it's amazing content. You had a quite good argument, and you highlighted some of the problems, and you proposed solution. I loved the slide where you gave the the highlights of the timeline, what you wanted to do. It's very feasible, it's very doable, okay? And there was one of the slides that was too tiny to read. You know, I couldn't really tell what was on there, but in general, I would say your presentation and group work was amazing. Everything was fine. And yeah, the conclusion and your summary and your introduction and your welcome, I acknowledge the thank you speech, and I appreciate all of you. Okay, thank you.
Thank you, Dr. Isha. Laura, we'd love to hear your thoughts.
Thank you. And again, thank you everybody so much for having me here. And I love your presentations. You did a fantastic job. From the moment you all showed up, it seemed like a very powerful group. You're all very well-dressed professionally, had well alignment with the camera to show your professionalism, and knowing your age, that's huge to show that level of professionalism. And I really appreciated that. I loved the setting of the presentation. You brought us in, you created a story arc, and that's important to create that story arc. And I think that huge props to the team for thinking through that. And Margaret, you presented it very well. You really brought us into the presentation. So good luck with that. Good luck. Wow. Congratulations on that. A couple other things. Sometimes one suggestion I had for a couple of you is to slow down. While you are speaking, it is important to just take a deep breath and slow down what you're saying to make sure that it comes across. Because I could tell that y'all are passionate about the topic. I can tell that y'all knew what you were talking about. You obviously had a script that was rehearsed, and that was good. Sometimes when you're reading it too fast, and that can happen because you're nervous, it makes it seem like what you're saying is not something that you care about, but it's something you're just kind of getting through. So just take a second and slow down. Slow down what you're saying, slow down what you're trying to say. The other feedback that I had, it's okay, the other feedback that I had was you put on the actual slide, you put SWOT. And I know what SWOT means, but it doesn't mean that that translates everywhere in the world. And it doesn't translate. So if you're making a presentation that is meant to have a global audience, for example, not everybody might know what SWOT means, especially if you're speaking to someone outside of an English-speaking country or something like that. So you might want to just spell it out, like strengths, weaknesses, etc. Not everybody also uses that methodology. There's also other methodologies that are a little bit different. And it was also, Jalen, you were doing such a good job at describing each of them. But I kept on looking at SWOT, and it took me a second, if I'm honest, to remember what SWOT was. and so it was distracting me from what you were saying. And you never want what's on screen to distract the attention from you, because you were doing such a fantastic job at saying what you're saying. Overall, I love the energy that you guys brought. In terms of the content itself, I absolutely loved the coloring sheet idea. That was really good because you were thinking about your target audience. You were thinking about both adults and children and creating content that was appropriate for the target audience. And that's really important in any public health campaign. I'm sorry, I'm reading through my notes, so I'm trying to make sure that I get through everything. And yeah, we did a really good job with the educational campaign. This is my lack of knowledge. I was a little bit concerned about the budget. I was like, $250 to print all those stuff. That's great. I'm also work with very different numbers, so not sure. But other than that, I think you guys did it. I would have loved to see a little bit more of a breakdown of the budget. Like you guys said, $250 can achieve all this. And I was like, okay, that's optimistic. Awesome. So maybe a breakdown of like, no, that shows that you did your research and understanding what each cost might look like. That is helpful in understanding budgets and proposals. But overall, good job and congratulations. You did an amazing, and I am 100% positive that anything you guys continue to do, you will grab from this to take to your next steps.
Hey guys, this fantastic presentation. I do want to answer Laura's question. Laura, they're using the LI printer at the LI office in Nigeria, so they're just paying for paper. We're providing the ink and everything else, so they're all set and ready to go. Sorry, they're providing the ink and paper, but we buy it in bulk, so that's why we have those low prices. Hey, Rasheen, you've had fantastic focus. Margaret, you brought your team together. Sanjana, thank you for the focus and determination throughout the entire week. I could see it in the presentation. Jalen, you brought it all. Like you made sure we understood where your presentation was going. Abarami, way to take the lead, move the presentation along, make sure everyone was included, make sure every transition was there. Taylor, thank you for your thoughts and passion. You guys, as high schoolers, bringing a presentation like this to birth, because you're starting from scratch. You literally didn't know anything about the disease. 2 weeks later, you're presenting to judges, professional individuals, how you want to implement an actual campaign in a city you've never lived, in a country you've never been to, with a budget, getting it off the ground. This is fantastic work. I am honored to work with each of you. To college admissions officers, individual bios, websites, and actual videos of them diagnosing a real life patient will be below this video, along with our LI office number. Feel free to call us anytime about this program or specifically the students. We are honored to work with each of them, and we'd be happy to tell you more about why they'd be amazing candidates for your universities. Everybody give yourself a round of applause. Amazing work. I'll be ending the video here.